Hi everyone, I am Julie Hershberg, and this is the second in a series of videos about exercise for people in Parkinson's. Yesterday, Dr. Cottle did a great segment on exercise and sleep, and so you can check that out on our Facebook page as well. And today I want to talk about something that's really close to my heart, and that is the effect of exercise on sleep. Oh, excuse me, not on sleep. We're oversleep. This is why I need exercise. It's on thinking and memory. And honestly, I see this one a lot in my own life because after I had kids, my brain kind of went to mush. And I really needed exercise to help me think more clearly, improve my memory. So this is something that I have seen personally, but now there is a lot of research coming out in all kinds of different disorders, but specifically in Parkinson's, on the effect of exercise in thinking and memory. So I wanted to talk about today were a couple of things, and one of those is first, how exercise affects thinking and memory. And then the second is get to the nuts and bolts. Like, how are we going to do this? And how can we help you do this? So the first question is, how does it work? Does it work? And of course, yes, we wouldn't be having this conversation without that. But I want to talk to you a little bit about the research. So there's three simple ways that has been shown in research, specifically in Parkinson's and other diseases, maybe even more importantly in diseases like Alzheimer's disease. This is a hot topic of research. So a couple of things that happen with exercise to the brain. One is increased blood flow, and this is really important when we're talking about the changes that occur in the brain, neuroplastic changes. They need the blood flow. This is like the substance of neuroplasticity. So it sets the brain up for those neuroplastic changes. The second, and this is really important in Parkinson's, it alters dopamine and glutamate neurotransmission. And we all know in Parkinson's, dopamine is the big culprit. So through exercise, this transmission is changed. And they're still really trying to understand exactly how this happens. And third, and maybe most importantly, is that we have an increased number of brain synapses or connections, and they become more efficient. And this is the key to improving our memory and thinking. Some of the things that change with these, when we see these brain changes, we see improved executive functioning, improved visual perception. We see improved memory. That's probably the biggest thing that I've seen once I've done more exercising. Improved clarity of thought, which you need for doing things like these little Facebook Live videos. So all of those benefits from exercise. Now, you probably really want to know, how are you going to do this? What does the research show for the kind of exercise that would be most beneficial? And I'm going to give you the hard news first because this is kind of difficult. It takes a huge commitment. It's not a magic pill. It's going to take a lot of hard work and effort. And most of the research studies that have been shown benefit so far, people are exercising for at least 30 minutes. That's a minimum, at least 3 times a week, and for 3 to 6 months at a time before they're even seeing benefit. And I know that's a lot of work. But don't get overwhelmed. You can start with a very, very little amount to get to that level. We're currently doing a study at our clinic right now, and it's going on for 12 weeks, 3 times a week, so 36 visits, either doing skill training or aerobic training. And that takes us to our next key point for the nuts and bolts is what type of exercise. And I know Dr. Cottle talked about this a little bit yesterday. The types of exercise are important. So 3 different types have shown specifically in Parkinson's to be very important for improving thinking and cognition. One is called skill training, and maybe that's kind of a weird name for exercise, but this is things that work on coordination or activities that are new and take a lot of focus. I specifically think of learning something new like golfing and how much attention and focus that took for me to learn it. Well, that was actually improving a lot of those connections that are involved in thinking and memory. The second is aerobic exercise, and this is probably the biggest one that's been studied so far. But aerobic exercise means you're exercising at a heart rate that is more than what you rest at. So very, very important to hit a target heart rate and also to work really hard. We use something at the clinic called the RPE, rate of perceived exertion. So we ask you, how hard are you working? It shouldn't be like a walk in the park. It should be pretty high. If we're going from 0 to 10, we should be at a 6 or 7 and at least working at that level to get those benefits to the brain. And then the third thing is resistance exercise. And this one actually surprised me when I looked at the literature. But some of the traditional exercises, such as lifting weights and using bands and things, those can also improve your thinking and memory in different ways. Now, it would be nice to do all three of those at the same time. And actually, there are ways you can do those all together. But regardless, incorporating some type of one of those exercises, skill exercise, aerobic exercise, resistance exercise, it's going to give you the most bang for your buck for improving your thinking and memory with Parkinson's. So finally, the last thing that I want to talk to you about is that you just need to start. It does take a lot of exercise. It takes a big commitment, but the number one thing is just to make the smallest change and you can build on that. It might mean just starting with 5 minutes. Maybe right now you don't even get up to take a walk. So start with a 5-minute walk and you'll start making those changes gradually. It doesn't have to be overnight. And it's often very helpful to have a family member, friend, your physical therapist to help you in this journey. So I encourage you to start. If you need help getting started or staying motivated, I encourage you strongly to sign up for our newsletter online. It's at www.reactivept.com/online. Join our private Facebook group. You'll see a link to it there. You're going to get a bunch of videos and free info to help get started and to stay motivated. We know how challenging it is. Our mission is to help everyone fight Parkinson's through exercise, and we're really excited to join you in that fight. We can't wait to see you online or in our clinic. And yeah, have a great day. Get exercising.